Hello, my name is Akwetey Akrong. I'm a nurse practitioner here at Reverence Behavioral Health Services. And I'm just trying to fill you in on some of the services that we provide and what actually separates us from other people who provide psychiatric services. For a long time, you go to a psychiatrist and you have a conversation, and the really good ones are able to get to conclusions, but not everyone is excellent. Not everyone is able to get to the root of the problem because we do have some conditions that seem exactly like others, and there's so much crossover when it comes to diagnostics and when it comes to symptoms. So diagnosing can sometimes be a problem. So here at Reverence Behavioral Health Services, we want to take an approach where we can measure twice and cut once instead of cutting once or cutting twice and then measuring so many different times. So part of our process is actually doing labs. So we'll get your blood work. We'll also do a spectral EEG. So what is a spectral EEG? EEG is an electroencephalogram. With this electroencephalogram, we actually map the brain, look at the speeds, and able to see different patterns. Now, this really helps us when we're looking at diagnosis and trying to differentiate between one or the other. And it's also part of our plan with the peak logic and also the PRTMS that we provide over here. So if you were to come in for an evaluation, what we do provide is the EEG. You just go into a small room, darken it out, and then get you into a meditative state. While in that state, we use this device over here. It's a Brain Master, and this Brain Master does the EEG. Just put it on your head. It usually takes about 10 minutes, and we're able to get a full picture of your brain, especially for what we're looking at with the speeds and also the different patterns. And with that, we're able to diagnose and then also be able to look at different things. You can look at hormonal issues. You can look at even diagnoses like autism, ADHD, anxiety, depression, even look at sleep issues. So it really opens the door to what we're able to diagnose and also what we're able to treat alongside with our PRTMS program. So as I said over here in Reverence Behavioral Health Services, we're not your average psychiatric wellness. We're not your average psychiatrist. We really want you to be well. And to be well, we first need to come to a really good diagnosis. So this is part of what we do to help us to get to a really good diagnosis and get to a perfect treatment plan that is suitable for you. So if you're looking for a new psychiatric practice or you're having some issues that you want to figure it out, please search for us online, reverencebhs.com, or you can go to other platforms and you can find us there. Thank you very much.